Welcome, everybody. My name is Lani Knutson, and I am the CMD Advocacy Team Lead. And I'm here with Sondra and Sarah, and we're going to give you an update on some of the things that we're watching in terms of advocacy. But I'll let them introduce themselves now. Sarah?
I'm Sarah Foye, and I'm founder of Team Titin and a very fond friend of CMD and a foundation building strength.
Hi, I'm Sondra Mermelstein. I'm a patient advocate from District 11 in New Jersey, and I've been advocating for CMD since I received a Bethlehem myopathy diagnosis several years ago.
Great, thanks for joining me today, ladies. So to start off, I'll just mention that I started advocating in 2019 when I went to Rare Disease Week in Washington, D.C. I squeezed in another trip in 2020 before the pandemic hit and have been mostly advocating virtually at this point. And I just wanted to clarify that advocacy can take on a lot of different forms. We do it all the time. But today we're going to talk mostly about legislative advocacy, what is happening at the federal and state level to bring awareness to the needs of the rare disease community, including the CMD community. You can be any age to advocate. We have advocates in the CMD community who are teenagers. You don't have to be affected. You could be a caregiver. You could just be a friend of somebody. Those stories and those perspectives are important. Because we are a small organization, rare, obviously, means that we don't have a huge population to draw from. We partner with several other organizations who are helping advance the rare disease community at the legislative level. You can find all of those resources if you go to our website, curecmd.org/advocacy. And on there, it'll show you ways that you can get involved at the federal level and at the state level in your own state. And also some resources on how to tell your story, including a CMD fact sheet that has information that you can use to give to your members of Congress or your state legislators. And if you ever have any questions, you can reach out to me. My email is Lani, Lani, knutson@curecmd.org. So today we're going to give you a little update on some of the bills and legislative actions that we're watching here at CMD. And I'm going to throw it over to Sarah to get us started.
Thank you for that introduction. One thing I would say about advocacy is that Lani makes it pretty easy to jump on board to advocacy. And there's no need to be an expert. That was something I worried about, is would I know answers to all the questions? But guess what? That's not necessarily your role as an advocate. You're just trying to support and advance the causes that are important to you and your family. So those resources make it really easy to get involved and jump in without any expertise. The other thing is that you get a chance to meet really great people. And when we were doing in-person or even the virtual meetings, we got to meet people from all different advocacy groups that could help you tap into local resources. And I met Sondra and we've become friends, which has been really nice. So it's also fun and you can meet friends. So I recommend it. Today, we're just going to talk about a couple of different legislative initiatives as a starting point. The first one is the SSI Savings Penalty Elimination Act. And this is really, I think, very important because with the current setup for SSI, it really does push people with disabilities into poverty. And this bill is aimed at addressing that. For example, the asset limits for those receiving Supplemental Security Income or SSI is limited to $2,000 for singles and $3,000 for married couples. And these asset limitations haven't changed since 1989, which, look around, the economy has changed a lot since then, even in the last couple of months. So that is one bill that you could support. And the Senate bill has this number for every bill for the Senate or that the House, it has a number. And there's a really easy way to support this bill, which is through this organization called the ARC. And you can click on that to take action to contact your senators and or follow up with a phone call. And by the way, that organization, the ARC, is present in many states. And that's how I learned about a lot of different benefits for my family, and it helped really going to their webinars and stuff. They have expert resources. So maybe you could check that out for your state. So ICD, what is that? It's an international classification of diseases. Given that a lot of us use a lot of medical resources, we might be familiar with ICD because it's also like the codes that people use for billing. And according to the World Health Organization, ICD codes provide critical knowledge on the extent, causes, and consequences of human disease, and also death, because it's used on death certificates. And that is worldwide. And that is data that's reported and coded using this ICD. So there's many people with rare diseases that don't have a code or didn't have a code until very recently. And so they would use like a generic code like other muscular dystrophy, or I don't know the exact one, but for congenital myopathy unspecified, or something very general. And that's hard to classify a lot of detailed information about a particular subtype without having these codes. So there has been a movement in advocacy to get a code, not only for the rare muscle disorders, but for all the rare diseases. So there's been some progress, but we're not there yet. But there has been some progress on the limb-girdle muscular dystrophy codes, but we still have more work to do. And you can click to this link here through the Muscular Dystrophy Association website for more information. So those are my two examples of advocacy. And now I'm going to turn it over to Sondra.
Hi, the first act I'm going to talk about is the Speeding Therapy Access Today, or better yet known as STAT Act. It's easier to say STAT. The best thing about this act is that it's going to create a rare disease center of excellence at the US Food and Drug Administration. And by doing this, it's going to help accelerate rare disease therapy development, optimize coordination between agencies, advance science-based regulatory policies, and basically facilitate access to therapies. As we all know, there's limited research and studies, and this is just going to help accelerate it. And to do more about this, you can refer to the rdla.org website. That's rdla.org. You can find out more information about this bill, which in the House of Reps, it's HR 1730. In the Senate, it's S670. The link below, you could take a picture quickly with your camera, your phone right now, or again, go to the rdla.org website and put in STAT Act. You'll get a lot of information. The next act that I'm going to talk about is called the Air Carrier Access Amendment Act of 2021. Right now, there have been a lot of accommodations made on aircraft with 2 aisles, but not much has been done on single aisle aircraft. So more needs to be done in terms of if you're traveling with a wheelchair or you have another type of disability. This act is supported by the MDA, a number of organizations, veterans groups, etc. But it also will provide a means of filing a complaint with the Department of Transportation, and again, make other provisions for traveling, whether that be with bathrooms, where to put carry-on luggage, etc. So a quick way to call your senators or write your senators and House of Reps, you can refer to the MDA.org and their advocacy page, or look at that link. In the House of Representatives, the bill is HR 1696. In the Senate, it's S642. I just also want to note that both the STAT and air carrier access need more co-sponsors in the House of Reps and Senate. In the House, there's about 40 co-sponsors for each bill, and they're very bipartisan bills. and more is needed. The STAT Act in the Senate only has one sponsor, and the air carriers has several more. So by making a phone call to your congressional rep or senator's office, sending a form email or writing your own personal email, that will help put those bills in the forefront and get them passed sooner. So co-sponsorship is needed. Thank you.
And lastly, I'll talk about something that you could get involved with at the state level. In 2015, North Carolina passed a bill that created the very first Rare Disease Advocacy Council. And since then, NORD, which is the National Organization for Rare Disorders, launched Project RDAC. So RDAC stands for Rare Disease Advisory Council. And these councils are an advisory body that gives the rare disease community a stronger voice at the state level. RDACs address the needs of the rare disease patients and families by giving stakeholders an opportunity to raise awareness and make formal recommendations to state leaders on the most important issues they face. Many of our laws are made at the state level and not at the federal level, including access to Medicare and Medicaid. And so the RDACs are meant to help elevate the needs of the rare disease community. Since 2015, I'm happy to announce that 21 states have established an RDAC. And you can find out if you have one in your state by going to NORD's website. I also have it linked on the Cure CMD advocacy webpage. And just look under state level advocacy and click on Project RDAC. This past year, I've been helping work on creating a bill here in Wisconsin where I live. Unfortunately, we didn't get it passed this session, but we're still optimistic that we can get it going. Every RDAC looks a little different in each state. And you can learn about what it looks like in your state or if your state has one. But it's a really important body to create a voice for those with rare disease in each state and not just at the federal level. So that's the updates we have for you today. But if you have any other questions, there are many other bills and acts that we support and are watching. But these are just kind of the hot topics right now. Again, always feel free to reach out to email me if you have questions or want to get involved. Our social media also gives alerts to when you can send a quick note to your members of Congress to support bills and acts that will support our community. And also, I regularly send out email updating people on advocacy and what's happening and how you can get involved. How much you get involved is totally up to you. For some people, it's 5 minutes a month, and for some, it's more. So it just depends on, but it doesn't have to take a lot of time. And we would love to add your voice to our Cure CMD community advocacy. And that's all I have for now.
I just want to say thank you for making this easy to be a legislative advocate, and to both of you for being a great role model and what good advocates look like.
Well, thanks, Sarah. I think someday somebody's going to get sick of me telling the story, but they haven't yet. So I keep coming back.
I want to thank both of you for being role models and friends. It's just been being part of this helps you feel that you're not alone and that you can do something. And you've both been wonderful resources, and among others in the CMD community. So thank you very much.
And hopefully soon we will get to see each other again, maybe at the next Rare Disease Week in 2023. Fingers crossed. Well, thanks everybody. Again, feel free to reach out anytime if you have questions or want to get involved. Thanks. Bye.